Healthy sexual function requires good circulation and good core tone. Let's talk about this. Hi, I'm Dr. Peter Minky. This is Minky Wellness. And we can't get through a wellness approach to the reproductive system without talking about good sexual function. I mean, I'm sorry, I would do you a disservice, okay? But we want a wellness approach to better sex, right? We want it to be, we don't want to just put a whole, using a drug or something else and jam a whole bunch of circulation down into an area, and then it can't get back out, and you see all these warning signs, okay? In the commercials, that's what I'm talking about. And so let's talk about what's going on. How do we need good circulation. We need good blood flow coming in, blood flow coming out. That requires the certain structural things. So I'm going to use my skeleton here to show you what's going on down in the core. The other thing is we need good tone. In order to get good circulation, we need good tone. Okay. Now I've already shown you some videos that I will link in the bottom in the notes section that have talk about getting good circulation and good core tone. I'm going to review it briefly here, but I've already shown you those videos, so I'm going to refer back to those. But let's look at what we're dealing with here. Here's our skeleton in miniature. Okay, this is most people sit most of their working life, right? Okay, so here I am sitting. Now, what do you think is happening to the circulation through the pelvis, right? So here, this is the joint we're talking about. This is the area we're talking about. Here's the pubic bone. Here's the hips, right? Here's the pubic bone. Here's the hip joint, pelvis, right? This is what I'm talking about here. Here's the lumbar. If we flip the back side of this, here's the sacrum. So you talk about the lumbar and the sacrum. The sacrum is, this is the only bone connection right here, the sacroiliac joint. Sacroiliac joint is one left and right. And of course, we all know about SI joint from a standpoint of the nerves. Here's the piriformis muscle that goes right here, and if that thing squeezes down on a nerve pathway that runs down this way, and of course it runs across sometimes, and so if you're sitting all the time, you're right here on the sits bones, you can jam into that nerve, etc., and so you get numbness and pain coming down one side or the other or both. But here's the bone joint, right? Now, if you rock let me get the lining up here. Okay, you rock the pelvis. That joint does need to move. Now it's going to be a little bit stiffer, but there's a lot of connective tissue in here. But that's what we're looking at. We want the pelvis to be able to rock and move. If your pelvis is stuck like this, right, with your lumbar forced backward. Sorry, I got my fingers in the way. But here's the pelvis rocked backward with the lumbar jammed all the way back. What do you think is going to happen to the organs that sit inside this bowl, right? And again, here's the area we're talking about. Here's the pubic bone. Here's your belly button, here'd be about your belly button. You go down to the pubic bone. The sexual organs, penis, vagina, are below that. This is where the action is right here. This is where we're talking about. Okay. And we've got to get good circulation in there. Do you see the problem? Especially if we sit a lot. And you squeeze this down, all this is just getting tighter and tighter and tighter and tighter. And for women, that's definitely not going to, help things feel good, which means you're not going to be interested. But for guys, you're not getting any blood flow through there. Sitting, crunching all this down. So we've got to figure a way to get this open, right? Then so that massage that I'm talking about to open the front of the hip joint is to get circulation, lymph, and blood through this area, getting all this going, okay? And of course, if you have a pattern where your knees are coming together, which means all of this is tight, okay? And again, we're squeezing this area down here, okay? And you can see there is a certain amount that this could actually squeeze to the point where this is really, really narrow, okay? So depending on what's going on with your pelvis is going to dictate what's going on down here. But I want to point out here, there is nothing supporting this. It's just open, okay? And so here's the anus would be right in front of the tailbone. Here's the tailbone right here. And so here'd be the anus, here'd be the penis would come out this way or the vagina this way. But this is the soft tissue. You need muscle. You need good muscle, good tissue quality to maintain the support here. Otherwise, everything's sagging out, falling out, and it doesn't, you're not going to get good, you're not going to have good sex. Okay, that's the bottom line. Things are going to be falling out. Okay, so how do we get there? We have, like I said, we got a massage form that I did that I'll show you the video, but I'm talking about that massage. We're pulling upward across the hip joint and then doing the lower massage, and we used the Sacred Mountain oil for that. Good. Enhancement and to enhance that massage, okay? And we have the core tone or push squeeze Kegel, the Kegel exercise, okay? And as you, boy, I can't do that from here, but I've got a video on that. So it's its own 15-minute video. The push squeeze Kegel, push squeeze push Kegel to get that Kegel going. If you want to do a real quick version of it, squeeze your butt together, bring your butt cheeks together, and then Kegel. You can't just Kegel. Most people are trying to Kegel is the muscles that stop your pee. If you try to do that, it just kind of pushes more out. You've got to get that action coming up and in to support the sling underneath. But I'm going to give you what I haven't done already to promote circulation down in the pelvic area, and that's breathing. And you're going to be like, what? Okay, no, listen to me on this one. Your consciousness and your breathing, your diaphragm pumping down here will pump the abdomen and pump the fluid moving in the abdomen, especially the lymph. Once we get if the lymph is clogged, circulation is going to be clogged, the blood flow is going to be clogged. So we can do that just with pure breathing, but literally your consciousness can move blood through your tissue. And it's okay if you're not good at this when you first start. Okay, and all these things, keep in mind, these things, this massage that I'm talking about, the push squeeze Kegel exercise for core tone, and this breathing, this directed consciousness through breath, what I call therapeutic breath, you're not good at this right now, okay? I understand that. It's like a child that sits down at the piano and, ting, 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 they don't know how to do it. And it doesn't sound good. But to them, they're super excited because they're now playing the piano and they look to you and go, hey, wasn't that great? And so we need to be more childlike in this and say, okay, I'm learning a new skill here. I'm learning how to breathe. I'm learning how to pay attention to my body. I'm learning a new skill. And I don't have to have perfection. The world expects instant perfection from adults. That's what we market out there. So we need to be what? We need to be brave. We need to get our valor, right? We need to be brave, put our valor on, and we're going to take charge of our health. We're going to take charge of our reproductive system. We're going to take charge of our sexuality. And now what we're dealing with is this sexual and/or ritual abuse, the cultural abuse. So I'm going to get my Sara out, and I'm going to put a drop of that. There you go, or two. And I'm going to put that across my forehead because it's really my mind that gets in the way. And most of the time, we talked about stress being a factor, a downer on our sexuality. And I'm going to release all that baggage. All right, I am going to let go of all this stuff associated with sex and reproduction and all the rest of this stuff. And I'm going to go ahead and put that down on my pubic bone down there at the below the belly button, anywhere down there. Let all that go. Okay, now we are going to, now that we've got our oils, we're going to do some breathing for circulation for better sex. Okay, now this could be, I'll do a whole video on breathing for sex while you're doing that, while you're having sex, and that can help encourage your togetherness. But I'm going to share with you here just that breathing to get circulation. So I'm going to breathe in. We've done a little bit of this before, not a whole lot this month, but breathe in and awareness. And I'm going to breathe in that awareness to my belly, okay? So I'm going to get that diaphragm, push down with my diaphragm, feel the fluid pump down, okay? And the pressure of there should allow me, if I really work with that, should allow me to physically, pressure-wise, get all the way down to the pelvic floor, okay? Okay, I'm sitting on the pelvic floor. I've got pressure coming up from the chair, and I'm going to breathe down, and I'm going to feel that pressure in the middle there. And there's likely going to be an awareness gap, okay? There's probably, most people do not have a good awareness of their genitals in terms of, having full ownership. So I'm going to breathe down and become aware, okay? And just bring light and love down into my reproductive system. For me, it's the prostate, genital, prostate, penis, scrotum, testes, For girls, it's going to be starting internally with the ovaries. For guys, we start internal with the prostate. Girls with the ovaries, a little bit to the back on either side. Uterus, cervix, vagina, outside part. Okay, so breathing in. Now I'm going to breathe light and love. And just shine and light and open it up, lighten it up, get some awareness, and chase out any darkness. Now with the breath, as I pull air into the middle, I'm going to pull circulation up into the core, okay? So this action of sucking, okay, with the air, I'm going to use that same action, and I'm going to pull fluid across my hip joints, starting really at below the pubic bone, and I'm going to pull up and in, okay? So where I am focusing is right in here, and I'm going to pull up and in, right? That's the focus. That's what I'm going to do, is pull that fluid into. So I'm here, and it's like, right? And I'm pulling that. That's the image that I'm using, okay? Now we can do our push, squeeze, Kegel and our massage across the hips, and really get circulation moving. Now this is a fabulous breathing exercise to get the lymph drainage in your legs, okay? If you're having circulation problems down there in the legs, to use your consciousness and pull that fluid, one leg, then the other, one leg, then the other leg. Okay, now I don't want to ignore the back, so we're going to go to the sacrum, so the same place, but I'm going to go breathe down this side to the tailbone, and then when I breathe, and I'm going to pull up, okay, that side. Now again, so the diaphragm physically is going down and pumping this, but my mind is participating in pulling this fluid. Now I'm going to send the goodness, send the circulation down to the genitals. Okay, and I'm really bringing not just circulation, but good nutrients, all the fabulous nutrients we've been using in our program. And I'm going to feel that circulation flowing through the organs, through the genitals. Now, if this is going to get you kind of riled up and you don't have an outlet, then you kind of, again, work on with the release oil and let that sexual energy build. And that's good for creativity. It's good for your energy. It's good for your skin, actually, to have a certain amount of sexual energy built up in your system. Obviously, you don't want that, to have it be something that you're frustrated with. So we want to build that sexual energy. Okay, and that's a whole different sort of feeling the sexual energy moving through the body. Okay, and have it come from there. Okay, if you want to call it the root chakra, you want to call it the sacrum and the energy, the whole center of the pelvic system, reproductive system. I'm going to expand that energy and bring it up and have it come through my body, okay, and have that sexual energy be present in my life. This is what chastity, this is the Catholic definition of chastity, is proper integration of your sexuality into your life. So from a Catholic perspective, if you're single, you shouldn't be having sex. But that doesn't mean you're not a sexual person. It doesn't mean you don't have interest. If you're a married person, you should be having sex. Okay, that's a necessary and important part of the marriage relationship, okay? So this is chastity. A single person needs to be chaste, but a married person needs to be chaste, okay? And that sex within marriage is something that is life-giving and sharing and bonding, okay? So we need to get good at this. And I'm sorry to say our Western culture is so messed up and disordered from pornography and all the other images that we get and all the other perspectives we get on this. We need to have a very healthy wellness perspective on this. And I hope I'm offering that to you in this kind of approach that I'm taking. So I hope this has been useful. And again, I'm going to do another video on actually breathing for the bedroom. So for those of you who are brave enough to go into that, we'll do that. So happy wellness. We'll see you tomorrow.